Okay, the brain. Before we begin with discussing the internal structure of the brain, we first must begin with the meninges. The brain, we have to understand, is a delicate organ, and it has to be surrounded and protected. And this is accomplished by three membranes called the meninges. The outermost membrane is the dura mater, which means tough mother. And it is the strongest layer. Located between the two layers of the dura mater are the meningeal arteries and the dural sinuses. The dural folds inside the falx cerebri, tentorium cerebelli, and the falx cerebelli. The falx cerebri separates the cerebral hemispheres, whereas the tentorium cerebelli, which spreads out like a tent, forms a partition between the cerebrum and the cerebellum. So that's something that we need to keep straight. The falx cerebri, as the name implies, cerebri means cerebral, and cerebelli implies cerebellum. And so that's one thing to keep straight. The cerebellum and the cerebrum. And so the falx cerebri separates the cerebral hemispheres, and the tentorium cerebelli separates the cerebrum and cerebellum. The falx cerebelli separates the two cerebellar hemispheres. And this will make much more sense once we actually see CT images of this. The middle membrane, known as the arachnoid membrane, is a delicate transparent membrane that is separated from the dura mater by a potential space called the subdural space. The inner layer, or pia mater, is a highly vascular layer that adheres closely to the contours of the brain. The subarachnoid space separates the pia mater from the arachnoid mater. And so that seems like a lot of things to keep straight, but once you actually see the layout in terms of CT, it will become more apparent. So here we have kind of a sagittal or a cross-sectional view of the way the brain and the skull actually fit inside of this space. Here we have the scalp, and just below the scalp we have the cranium, which, as we can see, is porous bone. And then below that we have the dura mater, which is comprised of this layer. And just below that we have the arachnoid. Then we have the subarachnoid space, which comprises this area. And then we have the pia mater, which is directly covering the brain. Here we have another view of the brain, and this is kind of depicting the tentorium cerebelli and the falx cerebri. As you can see, this is cerebrum here, so this would be our right cerebrum, and this would be our left cerebrum, with this being posterior and this being anterior. So as we can see, the falx cerebri is running in a sagittal direction from front to back. And we also have the tentorium cerebelli, which is really not demonstrated here very well, but we will see that in future images. Here we have this area and this area, which both are the falx cerebris. In addition, we have several parts of the skull that we must define. We have the frontal, parietal areas, and we have the occipital region. And so we say that this is the right frontal, this would be left frontal, and this would be left parietal, right parietal, and then occipital region of the brain. In addition to that, we also see this area here, and as you can see, it's kind of diverging, reaching back to the base of the skull. And this is the tentorium cerebelli. As we can see here, this is the cerebellum, and so this is separating the cerebellum from the cerebrum. In addition to this, we do have the ventricles. We have the third ventricle, and we have these interesting looking structures here that are kind of a tear-shaped area, and this is the lateral ventricle. Sometimes you'll hear this referred to as the horns of the lateral ventricle. All of this is applicable. Also, we do have the external occipital protuberance, and we do have the internal occipital protuberance here as well. Also, I would like to point out that we have a faint line running around the image, and this is basically soft tissue. This is your outermost layer of skin. So as we all know, the ventricle system is very important in terms of looking at the brain, and it's very important for us to distinguish what is normal and abnormal, so that we can better differentiate what is pathological and what is not. The ventricles, the ventricular system provides a pathway for the circulation of cerebrospinal fluid throughout the central nervous system. So the CSF, or cerebrospinal fluid, is very important, and maintaining it is very important as well. And so in order to do this and provide a pathway, we have to have ventricles. Much like the heart has ventricles for pumping, the brain has ventricles which allow passageways for the cerebrospinal fluid. The brain is composed of 4 fluid-filled cavities which are called ventricles, located deep within the brain. The 2 most superior cavities are the right and left lateral ventricles. The lateral ventricles consist of a central portion called the body and 3 extensions: the frontal, which is the anterior, occipital, posterior, and the temporal or inferior horns. The lateral ventricles open downward into the third ventricle through the paired interventricular foramen. And so once we see this on CT, it will kind of demonstrate to you how this actually works. The third ventricle is a thin slit-like structure located midline, just inferior to the lateral ventricle. So the important thing to keep in mind is that the third ventricle is going to be inferior to the lateral ventricle. And when we mean slit-like, it's going to have kind of an oval-shaped appearance. It's going to be hypodense. And so you probably want to put that into your notes, that it's going to be hypodense, meaning that it's going to have the appearance of kind of a black shade. The third ventricle communicates with the fourth ventricle via the long, narrow passageway termed the cerebral aqueduct of Sylvius. And so this goes back to Roman times, where aqueducts would allow the passage or the flow of water to remote areas. And so this allows the third ventricle to communicate with the fourth ventricle, which is pretty distant in terms of where it's located in comparison to the lateral and third ventricles. The fourth ventricle is a diamond-shaped cavity located anterior to the cerebellum and posterior to the pons. So that is something that you want to keep in mind. That's going to be anterior to the cerebellum and posterior to the pons. That will give you a precise location of where it is. The major exit route for cerebrospinal fluid passages the foramen of Magdalene, located on the posterior wall of the fourth ventricle, which allows communication with the cisterna magna. Also, we have the foramen of Lucica, which allows for the passage of CSF between the ventricles and the subarachnoid space. So I definitely know what this is and what it does. The choroid plexus, I'm sure that we've seen this on brains many times, is a network of blood vessels which produce CSF. This is supposed to be which, not with. And so definitely know that the choroid plexus is in charge of the production of cerebrospinal fluid. Frequently, the choroid plexus is partially calcified, making it more noticeable on CT. And so you're typically going to see this. Typically, you can see a calcified choroid plexus even on patients as young as 20 or even in their teens. Because it's one of the first few things that actually becomes calcified. So it's not too worrisome if you actually see this on a younger patient. Also, we have the arachnoid villi, which allows excess CSF to be reabsorbed into the dural sinuses. So definitely know this as well. Many times we have overproduction of CSF, and when we have overproduction of CSF with the inability to drain, then we have widening of the ventricles of the brain, and this is simply termed hydrocephalus when you have the inability to reabsorb the cerebrospinal fluid, which is why that you have to have a shunt placed inside of the skull. So this provides you with a little indication of where the ventricles are actually located. If we take notice, this huge, almost C-shaped area is the lateral ventricle. And so we see that we have the occipital horn, which as the name implies is going towards the occipital lobe or the posterior lobe. We have the temporal horn, which as we can see, it resides in the temporal area of the skull. Then we have the frontal horn, or we can shorten that for horn. Typically we just say horn of the lateral ventricle, typically used. That's what the name usually implies. Just below the lateral ventricle, we have the third ventricle. And then, as we see, the aqueduct of Sylvius actually connecting the third ventricle to the fourth ventricle. We kind of see the diamond-shaped appearance here. It's not quite as prominent as sometimes it will be. But the real thing you need to notice is that it's posterior to the pons and just anterior to the cerebellum. And so here would be cerebellum, and somewhere in this vicinity will be the pons. And so notice that it's posterior to the pons and anterior to cerebellum. Here's a coronal view, which kind of demonstrates it just a little better, so you can kind of see how everything is laid out. We have a bilateral lateral ventricle. We have both right and left sides. So if we're looking at this coronal from the AP to the PA view, we would have this being the right and this being the left. So this would be the frontal horn of the lateral ventricle bilaterally. Then this would be the temporal horn of the lateral ventricle. And we don't really see the occipital horn displayed very well. But then we actually have the third ventricle, which looks more slit-like, like someone took a knife and just sliced straight up and down, and you have an opening. And then we have the cerebral aqueduct, or the aqueduct of Sylvius, which is basically this long passageway extending into the fourth ventricle, which in the coronal view appears more of a diamond shape. So pretty much everything that is highlighted here will be fair game. Just really notice these structures. Things become a little more skewed when we actually look at it from an axial perspective. There's a certain layout, and several times you'll kind of obscure where everything is in terms of the lateral ventricle, most definitely, because it kind of runs together. So typically you're going to see this. And this is a lateral ventricle, and you can see bilaterally here. And then you have basically the frontal horn of the lateral ventricle. I know the book labels it as the anterior horn, but the frontal horn will be just as sufficient. Then we have what looks to be this slit-like appearance here, which is the third ventricle. We're not seeing anything else here. Well, also, let me go back and kind of erase some of this. This area in between, that's kind of separating the lateral ventricles, that is the septum pellucidum, which is, as the name implies, the separation point there. Okay, this kind of demonstrates to you where we're going to see the temporal horn. Notice that we still have, we're getting ready to, or we've just come from the base of the skull. We do see some of the circle of Willis coming in, and then we have this and this. This is the temporal horn of the lateral ventricle, and then we also have the fourth ventricle here. So this makes that this area the cerebellum, and we can kind of see, if I have the ability to erase here, this white structure being the tentorium cerebelli, separating the cerebrum from the cerebellum. Okay, let's label this structure as well. We have the frontal sinus, frontal bone. We're going to say that this is either temporal or parietal, being the mastoid air cells. We're going to say that this is temporal bone here. And we've got sphenoid here. Occipital bone with the internal and external occipital protuberance, mastoid air cells here and here. And then we see that we have the fourth ventricle. We have this being the tentorium cerebelli. Then we have the cisterna magna, a posterior portion around the internal occipital protuberance. We have the cerebellum and the cerebrum. This has the Pons labeled, but I feel that on the axial image this is very hard to differentiate, so don't worry about the Pons. Typically, when we want to view the Pons, it's going to be better demonstrated on a sagittal image, much like what we have here. This kind of puts everything into a greater perspective. As we can see, we have the dura mater here and here. And then we have the arachnoid, subarachnoid space, and then the pia mater actually covering the brain. We also do have what appears to be the lateral ventricle here. Let me erase that. This appears to be the lateral ventricle, with this being the third ventricle, with the cerebral aqueduct or aqueduct of Sylvius, with this being the fourth ventricle, this being cerebellum, and then this being the cerebrum. Here we have the pontine cistern, cisternum magna, and we'll look more closely at this when we actually get to CT. Here we are in the lateral ventricle once again. We have septum pellucidum here. We're coming out of the frontal horn of the lateral ventricle. We're seeing almost the occipital horn here, and interestingly enough, we see this structure here. This patient doesn't have a great deal of calcifications, but we do see some here, and the beginning of precalcifications there on the left side, which is the forward plexus. Additionally, on this image, we have falx cerebri here. Okay, the reason that I put this in here is because sometimes when you're scanning through the patient's head, the skull doesn't look all nice and smooth as you see some of these borders here, and you see this kind of choppy appearance, and that is pitting from arachnoid granulations, and that's just something on the image as you're scanning through an incidental find. So that brings us to cisterns. The subarachnoid space is a relatively narrow fluid-filled space surrounding the brain and spinal cord. There are locations primarily around the base of the brain where the subarachnoid space becomes widened. The combined term for these widened areas or pools of CSF is the basal cisterns. One of the largest cisterns is the cisternum magna, located in the lower posterior fossa between the medulla oblongata, cerebral hemispheres, and the occipital bone. The inner peduncular cistern, located between the peduncles of the midbrain and communicates inferiorly with the pontine cistern. The pontine cistern is located just anterior and inferior to the pons and communicates laterally with the cerebello-pontine angle cistern. The suprasellar cistern is located above the sella and contains the optic chiasm and the entire circle of Willis. Okay, on this image, let's get a few things out of the way. We have the frontal bone. Frontal bone here. Going through the base of the skull, we have basically the circle of Willis here. Kind of a star-shaped pattern. This is called the midbrain, located just posterior to the circle of Willis. We're not going to worry about all of the arteries on this because it's very hard to differentiate without the introduction of contrast. But we do have the suprasellar cistern, which is located here. The ambient cistern here. And that's pretty much it for this image. This image is slightly confusing because we are once again going through the base of the skull. We have what appears to be the sphenoid sinus here. And so we're seeing the orbits. So we have the frontal sinus, basically the mastoid air cells here. We'll call it MAC for short. We have the cisterna magna located at this point. Very hard once again to differentiate the pons, but just know that slightly anterior to the cisterna magna. And that will be it. We're not going to worry about the sola turcica because I have a feeling that we grasped that from the previous images, or previous stuff. So that brings us to the cerebrum. The cerebrum is the largest portion of the brain and is divided into left. Let's change this to left and right cerebral hemispheres, meaning that there is a line running from the front to the posterior portion of the cerebrum, which designates left and right hemispheres. Each hemisphere contains a neural tissue arranged in numerous folds called gyri. The gyri are separated by shallow grooves called sulci and by deeper grooves called fissures. So know that shallow grooves are sulci, deeper grooves are fissures. The central sulcus divides the precentral gyrus of the frontal lobe and postcentral gyrus of the parietal lobe. The precentral gyrus is considered the motor strip of the brain, and postcentral gyrus is considered the sensory strip of the brain. So know that precentral is the motor, postcentral is sensory. The two main fissures of the cerebrum are the longitudinal fissure and the lateral fissure, or the Sylvian fissure. And we'll see this kind of embodied in CT. The longitudinal fissure is a long, deep furrow that divides the left and right cerebral hemispheres. And located in this fissure is the falx cerebri and superior sagittal sinus. The lateral fissure separates the frontal and parietal lobes from the temporal lobes. So here we can see what is kind of an oblique view of the brain. You have the frontal lobe being here, the occipital lobe residing in the posterior, and then you have the Sylvian fissure, which is separating this with the central sulcus. This kind of allows you to see things a little more. You have the longitudinal fissure, which is dividing it into left and right. So this would be right, and this would be left sides of the brain. Then you have the Sylvian fissure, which is kind of separating the parietal from the temporal lobe. And then if we refer back to this image, we have the central sulcus, which the Sylvian fissure on this I feel is mislabeled. So let's just kind of remove this and worry about the central sulcus here. So here's a view from looking at it from an inferior to superior view. We have longitudinal fissure here. And that is pretty much it. Just know that this is frontal lobe, this is temporal, this is occipital here. So I'm sure, as we all know, that the brain is composed of both gray and white matter, and most people don't give it a second thought as to what this actually means, but it's very important. The cerebrum consists of gray matter, which is neuron cell bodies, and white matter consists of myelinated axons. The cerebral cortex, or the outermost portion of the cerebrum, is composed of the gray matter approximately 3 to 5 millimeters thick. Deep to the cortex is the white matter, which contains fibers that create pathways for the transmission of nerve impulses to and from the cortex. And so basically what this tells us is that on the outer portion of the cerebrum, you're going to have gray matter. And then as you go deeper, you're going to have white matter. And the differentiation between gray and white matter is this word here, myelinated. Myelinated means that it has the capability to transmit nerve impulses at a very rapid rate, much faster than non-myelinated cell bodies. And so that's why we see that white matter is going to be what is going to be used for the transmission of nerve impulses, because it can do it at such a rapid rate. It also brings us to the corpus callosum, which forms the roof of the lateral ventricles and connects the right and left cerebral hemispheres. The anterior commissure crosses the midline within the lamina terminalis and connects the anterior portions of each temporal lobe. The posterior commissure is a pathway made of several fibers that transmit nerve impulses for pupillary light reflexes. So the cerebral lobes. The cerebral cortex of each hemisphere can be divided into 4 individual lobes. And so we know this: frontal, parietal, occipital, and temporal. The frontal lobe is the most anterior lobe of the brain. As the name implies, it's the front. Boundaries of the frontal lobe are the central sulcus, which separates it from the parietal lobe. So know that the central sulcus is going to be running, if we draw a brain and we're looking down on it, and this would be the longitudinal fissure, then this is the central sulcus, dividing it into anterior and posterior portions. The lateral fissure, which separates it from the temporal lobe, and so basically if we were to flip it and look at it from the side, we have this type of area here, which is the lateral fissure. The frontal lobe is also involved with the production of speech and contains the motor speech center, or Broca's area. So the frontal lobe is going to be concerned with speech and motor speech. The parietal lobe, on the other hand, is located on the middle portion of each cerebral hemisphere, just posterior to the central sulcus. The horizontal portion of the lateral fissure separates the parietal lobe from the temporal lobe. The occipital lobe is separated from the parietal lobe by the parietal occipital fissure. It's involved in the conscious perception of visual stimuli. And so basically what the occipital lobe does is it takes what you perceive as visual stimuli and allows you to process this information, and it's concerned how you perceive things. The primary visual area receives input from the optic tract via the optic radiations extending from the thalamus. The temporal lobe is anterior to the occipital lobe and is separated from the parietal lobe by the lateral fissure. The superior temporal gyrus contains the auditory cortex, which can be divided into primary and secondary auditory areas. Heschel's gyrus, the primary auditory area, receives the major auditory sensory information from the bilateral cochlea. And Wernicke's area is a secondary auditory area, center for the comprehension and formation of speech. This is something that you want to put a star beside Wernicke's area, because it's going to be for the comprehension and the formulation of speech. It's typically, if you know where this area is located, then you can pretty much identify where an abnormality would be if a patient comes in and they're having difficulty formatting or formulating words. So to kind of demonstrate this, we have a basic layout of the brain. So we have the lateral sulcus here. It's the longitudinal fissure. And then we have the central sulcus, which is creating this division here. And so in our frontal lobe, which is this area here, we see that personality, behavior, emotion, and intellectual functions are controlled there. And also we have left and right brain. So that brings us to the parietal lobe, which is concerned with sensation. So the parietal lobe is going to be here. The occipital lobe, which is here, is concerned with vision and how you perceive things. The temporal lobe, or here, is concerned with hearing and smell. Basically, as we all know, the ear is located in the temporal region, and so because of that, it makes sense that this would be the location of where hearing would go. So located in the frontal area is Broca's area, which controls motor speech. And then in the temporal area, we have Wernicke's area, which is language comprehension. So Broca's area and Wernicke's area is going to be something that you want to keep in mind based on where abnormalities may exist. So here we have a CT image. Once again, we have parietal temporal area, or temporal bone. We have pretty much the dorsum sellae or the sella turcica somewhere in this area. We even have the mandible, or TMJ, being here. And then we have the sphenoid sinus here. Just slightly above this or superior, we have the lateral ventricle, or lateral ventricles. And then we have frontal horn of the lateral ventricles. And then we have this area in between, which is the septum pellucidum. Also, we need to label parts of the brain. This is going to be the parietal lobe. This is going to be right parietal, left parietal, right temporal, left temporal. Okay, going back to this area, we have falx cerebri, third ventricle, lateral horns, or frontal horns of the lateral ventricle. This is sternum magna. This is going to be cerebellum. And we also have this area here. Many times this gets slightly confusing, but because we do have symmetry, we know that this is not some abnormality, because any abnormality in the brain will definitely cause a lack of symmetry or asymmetry to the brain. And so because of this, we see that this is not abnormal, but this is the lateral fissure. Okay, the basal nuclei. The basal nuclei are a collection of subcortical gray matter consisting of the caudate nucleus, lentiform nucleus, and claustrum. Collectively, they contribute to the planning and programming of muscle action and movement. The largest basal nuclei are the caudate nucleus and the lentiform nucleus. The caudate nucleus parallels the lateral ventricle and consists of a head, body, and tail. The head causes the indentation of the frontal horns of the lateral ventricles, and the tail terminates at the medulla and the temporal bone, or temporal lobe. The lentiform nucleus is a biconcave lens-shaped mass of gray matter located between the insula, caudate nucleus, and thalamus. The claustrum is a thin linear layer of gray matter lying between the insula and the lentiform nucleus, and is thought to be involved with the mediation of visual attention. Okay, we don't need to be responsible for anything on this image. It kind of extends far beyond what we would actually see for CT. This, on the other hand, is something that we can utilize. Once again, we'll label the image. Falx cerebri, septum pellucidum, frontal horn of the lateral ventricles, lateral fissure, third ventricle, cerebellum, then we have the thalamus, located just beside the third ventricle. The internal capsule being just to the side. Head of the caudate nucleus, which is causing the indentation here of the lateral ventricles, which kind of gives it that teardrop shape. And then the fornix right here. That brings us to the Diencephalon. The thalamus consists of a pair of large oval gray masses that are interconnected with most regions of the brain and spinal cord via the vast number of fiber tracts. The thalamus makes up a portion of the walls of the third ventricle and connects to the middle of the third ventricle by adhesion, known as the massa intermedia. The thalamus serves as a relay station to and from the cerebral cortex for all sensory stimuli, with the exception of the olfactory nerves. So this last bullet point is something that you want to keep in mind. It's basically a relay station, but it doesn't work for the olfactory nerves. The hypothalamus consists of a cluster of small but critical nuclei located below the thalamus, posterior to the optic chiasm. It forms the floor of the third ventricle. It includes the optic chiasm, mammillary bodies, infundibulum, and the pituitary gland. Functions to integrate the activities of the autonomic, endocrine, and limbic systems by helping to maintain homeostasis as it controls activities such as the regulation of temperature, appetite, sexual drive, and sleep patterns. So the hypothalamus is very important, controls a lot of things, and so basically just know this last bullet point. It also modulates the activities of the anterior and posterior lobes of the pituitary gland through the release of neurohormones that stimulate or inhibit the release of pituitary hormones. And so it kind of helps control hormone releasing activities here as well. So that brings us to the pituitary gland, which is an endocrine gland located or connected to the hypothalamus by the infundibulum. We all know that it's kind of nestled or placed inside the cella turcica, and it's sometimes called the master gland because it controls and regulates the function of many other glands through the action of its 6 major types of hormones. So the pituitary gland is very important, but also the hypothalamus is very important because it has neurohormones which will act on the pituitary gland to cause the secretion of its hormones. So actually, while the pituitary gland may be called the master gland, that could be said for the hypothalamus as well. So here's an MRI image. Kind of demonstrates things to a higher degree. We have the thalamus here. We have the fourth ventricle. We have cerebellum. We have the medulla oblongata, the pons situated just above the medulla oblongata. The cerebral aqueduct, or the aqueductus sylvius. The pineal gland. This image is very hard to discern. This is the cella turcica. It's phenol sinus here. And the pituitary gland situated there. We're not going to worry about pituitary stalk because it's really hard to differentiate. Okay, this image we have the falx cerebri. Lateral fissures. The occipital horn. Third ventricle. Calcified choroid plexus and also calcified pineal gland. So the epithalamus. The pineal gland is an endocrine structure which secretes the hormones melatonin that aids in the regulation of day-night cycles and reproductive function. It sits on the roof of the midbrain just posterior to the third ventricle and below the splenium of the corpus callosum. It is sometimes calcified, which allows it to be demonstrated well on CT. The limbic system. The limbic system is a complex group of interconnected brain structures and fiber tracts located within and adjacent to the medial surface of the temporal lobes. It plays a role in the emotional aspect of behavior, so that's something that you want to keep in mind. It's going to play the role of kind of bringing about your emotions. It's involved in aggression, submission, and sexual behavior, memory, learning, and general emotional responses. It includes the hippocampus, amygdala, olfactory tracts, fornix, cingulated gyrus, and mammillary bodies. So the hippocampus is an important structure that has a strong role in the transition of memory from short-term to long-term. So basically, the hippocampus is in charge of taking your short-term memories and compacting them and processing them so that they're stored for a long-term goal. And so you cling on to the long-term memories. And so problems with the hippocampus can indicate basically memory loss. It'd be very interesting to see if hippocampus or hippocampus problems play a role in some of the mental illnesses where long-term memory is lost or short-term memory is lost. The amygdala is an almond-shaped mass of gray matter located deep within the parahippocampal gyrus, medial to the hypothalamus, and adjacent to the hippocampus. It coordinates the actions of the autonomic and endocrine systems and is concerned with olfactory reflexes and aggressive and sexual behavior. So just know the function of the amygdala. Olfactory tracts run underneath the frontal lobes and connect to the amygdala to bring information on the sense of smell to the limbic system. The fornix is an arch-shaped structure that lies below the splenium of the corpus callosum and makes up the inferior margin of the septum pellucidum. The cingulate gyrus is a prominent gyrus located on the medial border of each cerebral hemisphere just superior to the corpus callosum. It's considered to be the brain's emotional control center. So I definitely know the cingulate gyrus is going to be the brain's emotional control center. Mammillary bodies, two small rounded bodies in the floor of the posterior hypothalamus responsible for memory and motivation. So the mammillary bodies are going to be responsible for memory and motivation. So this image just kind of shows you what we're actually looking at. We have corpus callosum, the hippocampus, the medulla, parahippocampal gyrus, hippocampus, mammillary bodies. But basically, you won't have to worry about knowing this image because it's far too advanced for what we can actually demonstrate on CT. Okay, here we have hippocampus, amygdala, and the ambient cistern. We'll bypass this image. Don't worry about this one. So that brings us to the brainstem. The brainstem is a relatively small mass of tissue packed with motor and sensory nuclei, making it vital for normal brain function. 10 of the 12 cranial nerves originate simply from the brainstem. It's divided into midbrain, pons, and medulla oblongata. The tegmentum is an area that provides integrated functions such as complex motor patterns, aspects of respiratory and cardiovascular activity, and regulation of consciousness. It's located in the central portion of the brainstem. So the brainstem as a whole acts as a conduit between the cerebral cortex, cerebellum, and spinal cord. So this last bullet point is very important. We often lose sight of what the brainstem actually is, but it's simply a conduit, which allows passageway of nerve impulses from one area to the next. Located above the pons at the junction of the middle and posterior cranial fossa, the smallest portion of the brainstem is the midbrain. It can be divided into cerebral peduncles. There's two of those, which are large rope-like bundles of axons that are a direct extension of the fibers of the internal capsule. The tectum, there's 4 rounded protuberances. The upper pair, or the superior colliculi, a center for visual reflexes that coordinate the movements of the eyes with those of the head and neck. So basically, the superior colliculi of the tectum are in charge of making the eyes coordinate their movement with the way the head is actually moving. Lower pair, or the inferior colliculi, acts as a relay station for the auditory pathway, providing auditory information to the thalamus. So definitely know this point as well. The midbrain surrounds the cerebral aqueduct that contains cerebral spinal fluid. The quadrigeminal plate makes up the roof or dorsal surface of the midbrain. The red nucleus is composed of a tract of motor nerve fibers, and it serves as a relay station between the cerebellum and the cerebral hemispheres. It contributes to the coordination of movements and to the sense of balance. periaqueductal gray matter surrounds the cerebral aqueduct and receives sensory input that conveys pain and temperature to the brain. So the periaqueductal gray matter basically conveys pain and temperature to the brain. So here we see basically the pons and the pyramid of the medulla oblongata. The tectal plate the fourth ventricle, cerebellum, and then we have the central aqueduct, or the aqueduct of Sylvius. Then we have what we all know as the spinal cord, with the central canal running down. So this image just kind of demonstrates to you the visual impulses, how they come in, and how they are kind of dispersed throughout the brain. But the reason I want you to understand this image is because we're looking for the layout of the brain. Here's the pons, medulla oblongata, or the pyramid. We have the fourth ventricle here, cerebellum here, aqueduct of Sylvius, third ventricle, here's another axial image. We have lateral fissure once again, third ventricle, frontal horns of the lateral ventricle, cisternum magnum, tentorium cerebelli, falx cerebri. This is probably the anterior cerebral artery. Okay, here is fourth ventricle, cerebellum, frontal lobe, falx cerebri, hippocampus, pons being this large rounded structure there. So that brings us to the pons. Its name means bridge, and it's a large oval-shaped expansion of the brainstem centrally located between midbrain and the medulla oblongata. It creates a prominent bulge as it lies posterior to the clivus and the anterior to the cerebellum. And it relays signals between the spinal cord and the cerebral and cerebellar cortices. The medulla oblongata extends from the pons to the foramen magnum, where it continues as the spinal cord. It contains all fiber tracts between the brain and the spinal cord, as well as the vital centers that regulate internal activities of the body, such as heart rate, respiratory rhythm, and blood pressure. Anterior and posterior median fissures divide the medulla oblongata into two symmetric halves. The pyramids are located on either side of the anterior median fissure and contains nerve tracts that contribute to voluntary motor control. So the pyramids are going to be contributing to voluntary motor control. At the lower half, some of these tracts cross over to the opposite side, which is why the right side of the brain controls the left side of the body and vice versa. And so if you've ever wondered why the left side controls the right side and vice versa, this is it. The olive is located on the lateral surface of the medulla oblongata, and it's rounded oval prominence. It consists of a nuclei that are involved in coordination, balance, and modulation of sound impulses from the inner ear. So here we have the fourth ventricle, we have the pons here, the tentorium cerebelli, probably cristagalli here, cranial sinus, base of skull. We're looking at sphenoid bone here, and this is the cerebellum. Here we're going through more inferior portions of the skull, and so this is going to be the medulla oblongata. We've already scanned through the pons, and just anterior to the fourth ventricle. We also see that we have the maxillary sinus, mastoid air cells, EAM, so the cerebellum, it's referred to as the little brain. It attaches posteriorly to the brainstem and occupies the posterior cranial fossa, and it is the coordination center for motor functions. It does not initiate actual motor functions, but it uses the brainstem to connect with the cerebrum to execute a variety of movements, which is maintenance of muscle tone, posture, balance, and coordination of movements. Anytime that you have abnormality with cerebellum, you're going to have something go awry in one or all of these things. A lady where I work, she had problems maintaining her balance. She said she felt like she was just drunk all the time, and she was unable to actually walk down the hallway at the hospital because she just felt like she was the room was spinning, I guess you would say. And the doctor ordered a CT for her with and without contrast, and pretty much as soon as they scanned through her cerebellum, they just saw that there was several lesions through it and also into her cerebrum. And so because of these lesions in her cerebellum, that explained why she was having so much problems actually maintaining an erect posture and keeping balance, because she couldn't help it because she had this abnormality. So it's one of those things that when you know what things control, then you have a tendency to look there a little more closely. So it's very beneficial to actually understand this. Cerebellum is also divided into two cerebral hemispheres. Basically, just like the cerebrum is divided into right and left, the cerebellum is no different. The vermis connects the two hemispheres, and there's cerebellar peduncles. There's three pair, and where all information traveling to and from the cerebellum is routed. So just keep that in mind. And also the vermis. And also this is what actually divides the cerebellum into two hemispheres, the falx cerebelli. So here we just see the cerebellum. We're not going to worry about anything else other than here's the fourth ventricle, here's the pons, medulla with the pyramids, and here is the cerebellum. So the cerebral vascular system, in comparison with the arteries in the body, the walls of the arteries of the brain are thin and weak, which causes them to be susceptible to aneurysm and strokes. That's why it's always a concern if a patient is having symptoms of an aneurysm or if a patient is having symptoms of a hemorrhagic stroke, simply because of this weakness. The veins of the brain do not contain calves, which is misspelled. This should be valves, which allow the blood flow to go in either direction. As we know in the heart, there are valves. There's aortic valves, which prevent blood flow from actually going one way, going the opposite direction from what it's supposed to be. But the brain does not have this. And this creates a route for bloodborne pathogens to pass from the body to the head, and vice versa. However, we do have the blood-brain barrier, which the capillaries of the brain will not allow movement of certain molecules from their vascular compartment into the surrounding brain tissue, which prevents large amounts of contrast medium from entering the brain. However, always get asked this: if you see someone who has an abnormality such as a hemorrhagic stroke, what do? Should you inject the contrast or not? And there's several different ways of looking at this. Some physicians will say that it probably wouldn't hurt it if you actually did inject, but a lot, and the most prevailing thought is that you do not inject this because of this disruption in the blood-brain barrier. This will allow it to escape into the brain and can cause either poor reabsorption and then ultimately cause perhaps inflammation, or has the potential to increase pressure in the brain. And that's usually the prevailing thought on why you don't inject, is because it can increase the swelling rate of the brain that has already sustained trauma, which will then cause a significant risk to the mortality of the patient. So many times it kind of gets a little difficult to discern where all of the arteries and the vessels go in the brain. So in order to try and make this as simple and painless as we possibly can, this is our image here that will initially go by. We have the internal carotid artery coming up and then branching out. And then we also have the vertebral artery, which is going up through the transverse foraminum. And once it gets to a certain area, both the left and right vertebral arteries merge together to form the basilar artery. The basilar artery then forms the latter part of the circle of Willis, and as we can see, it supplies blood to the posterior portion of the brain, whereas the internal carotid artery is in charge of mostly supplying blood to the middle and anterior portions of the brain. Keep that in mind because that will actually prove very valuable as we look at things. Here we see what a coronal image would typically look like. You have basically the right and the left vertebral artery coming together and then merging at this point. At this point, it no longer is the vertebral artery, but the basilar artery. And as we can see, it continues up and then diverges. On the other hand, we've got the right and the left internal carotid artery, which go up and then come together in the anterior cerebral artery. So while the vertebral arteries meet very much lower to form the basilar arteries, the left and right internal carotids actually come together to form the anterior cerebral artery. Well, also middle cerebral arteries. And we see that we have middle cerebral artery, we have M2, M3, which is just further branching of the middle cerebral artery. So here we have what is very difficult to discern because we are looking at this in terms of bone windows, probably looking for bony abnormalities. So we do see the sphenoid sinus, maxillary sinus, the EAM, mastoid air cells, internal occipital protuberance, confluence of sinuses here, and then we see this little bitty area here, which is the basilar artery. It will become more apparent once we actually utilize standard windows instead of bone windows. So if we begin looking at the internal carotid arteries, we see that they supply the frontal, parietal, and temporal lobes of the brain and orbital structures. Notice that there is no occipital lobe here. They arise from the bifurcation of the carotid arteries in the neck, where the common carotid artery bifurcates into the internal and the external carotid artery. They ascend through the base of the skull and enter the carotid canals of the temporal bones. It turns forward within the cavernous sinus, then up and backward through the dura mater, forming an S shape before it reaches the base of the brain. In the cavernous sinus, it branches into the ophthalmic artery, just inferior to the anterior clinoid process. Then it runs lateral to the optic chiasm and branches into the anterior cerebral artery and the larger middle cerebral artery. So the anterior cerebral artery supplies the anterior frontal lobe and the medial aspect of the parietal lobe. Main segments are the horizontal, or the A1 segments, and the A2 segment. The horizontal segments extend from the internal carotid artery bifurcation and branches to the medial linostriate arteries and the anterior communicating artery. The A segment extends from the anterior communicating artery to the course around the genu of the corpus callosum. The middle cerebral artery is by far the largest of the cerebral arteries and is considered a direct continuation of the internal carotid artery. So basically, the middle cerebral artery should be very easy to discern because it's going to look pretty much the same as the internal carotid artery. And it supplies much of the lateral surface of the cerebrum, insula, and the anterior and lateral aspects of the temporal lobe, nearly all of the basal ganglia, and the posterior and anterior internal capsule. And so there's three segments. There's horizontal, insular, and opicular. But basically, all we're going to go with is the middle cerebral artery. So I'll know that there are three segments, but you will not be responsible for actually delineating these. The vertebral arteries begin in the neck at the subclavian artery and ascend vertically through the transverse foramina of the cervical spine. They curve around the lano-occipital joint to enter the cranium through the foramen magnum. The two vertebral arteries course along the medulla oblongata and unite ventral to the pons to form the basilar artery. The vertebral and basilar arteries give rise to several pairs of smaller arteries that supply the cerebellum, pons, and inferior medial surfaces of the temporal and occipital lobes. So here we have the posterior inferior cerebellar, or the pica, the anterior inferior cerebellar, or the ACA, the superior cerebellar, which is the SEA, posterior cerebellar, or cerebral, which is the PCA, posterior communicating artery, which forms a connection between the posterior cerebral artery and the internal carotid artery. So that brings us to the circle of Willis. Circle of Willis is a critically important anastomosis among the four major arteries, the two vertebral and the two internal carotid, feeding the brain, formed by the anterior and posterior cerebral, anterior and posterior communicating and internal carotid arteries. It's located mainly in the suprasellar cistern at the base of the brain, and there are many normal variations of the circle. Possibly no two circle of Willises will actually look the same. Functions as a means of collateral blood flow from one cerebral hemisphere to another in the event of a blockage. So here we have the internal carotids, and we have the vertebral arteries. Notice how much larger that the internal carotids actually are. And then we have the anterior cerebral arteries, posterior cerebral arteries. Also, the vertebral arteries, as we see, we have two here. We now have one, which is the basilar artery. Here we have basically the vertebral arteries coming up, forming the basilar artery, and the basilar artery providing all of these branches. And as we can see, we're primarily going to the temporal lobe, cerebellum, and the occipital lobe here. Then we have the anterior cerebral artery labeled with the orbital artery, but we don't see the internal carotid arteries here, so it kind of becomes slightly misleading. This will be typically what you're going to be looking at. Notice we have this going here, which is the MCA, which is the middle carotid artery. Notice how it's going kind of horizontal. The anterior carotid artery, or cerebral artery, will be going slightly anterior. And then we do see that we have this area here, which is the basilar artery. We have the falx cerebri here, lateral fissure here, and so this just kind of demonstrates to you all the branches. Here we have the right vertebral and the left vertebral coming together to form the basilar artery. Notice that we're getting ready to see the EAM. We're still seeing the maxillary sinuses. We have the orbits here. We have the zygomatic arch and the TMJ. And we have going into the foramen magnum. Here we can see that we have the vertebral arteries. We have the right and the left forming the basilar artery. And then the rest of this image kind of becomes very confusing, so I just know this lower portion here. Here we have the basilar artery again. We have the right and the left coming into the basilar artery. Pretty much the level of the EAE. So here is the right and the left basilar artery coming in. And this would be the carotids here. This will be your middle cerebral artery. This will be your anterior cerebral artery. And then we have the PCA, or the posterior cerebral artery, which is kind of completing the circle. So here we have kind of the circle of Willis coming in. So we have the anterior cerebral arteries, we have the posterior cerebral artery, middle cerebral artery, okay, so here we have the vertebral arteries, both right and left, forming the basilar artery. Then we have posterior cerebral arteries. We have both left and right internal carotids coming and forming the middle cerebral arteries, and then continuing on and forming the anterior cerebral artery. So here is a scan without very much contrast at all. We have the posterior cerebral artery, we have the middle cerebral artery, the anterior cerebral artery, the ambient cistern, fourth ventricle, cerebellum, lateral fissure, falx cerebri, frontal sinus, mastoid air cell, so the dural sinuses, very large veins located within the dura mater of the brain. All the veins of the head drain into the dural sinuses and ultimately into the internal jugular veins of the neck. The major dural sinuses include the superior and inferior sagittal, straight, transverse, sigmoid, cavernous, and petrosal. So the superior sagittal sinus. It lies in the medial plane between the falx cerebri and the calvaria. It begins at the crista galli and runs the entire length of the falx cerebri and ends in the internal occipital protuberance. The inferior sagittal sinus is much smaller than the superior sagittal sinus. It runs posteriorly just under the free edge of the falx cerebri and converges with the great cerebral vein to form the straight sinus. The confluence of the sinuses is the junction of the superior, sagittal, transverse, and straight sinuses. So where everything kind of comes together, which is what the word confluence actually implies. The transverse sinuses extend from the confluence between the attachment of the tentorium and the valvaria. As they pass through the tentorium cerebellum, they become the sigmoid sinuses. The cavernous sinuses are located on each side of the sella and body of the sphenoid bone. It's formed by numerous interconnected venous channels. They envelop the internal carotid arteries and several cranial nerves. They receive blood from the superior and inferior ophthalmic veins and communicates with the transverse sinuses by way of the petrosal sinus. So here's kind of what it all means. Remember, these sinuses are in charge of returning blood to the heart from the head. So it's very important that this actually worked very effective. So here we have the superior sagittal sinus, which is very large, running basically from the crista galli all the way to the internal occipital protuberance. We have the sigmoid sinus, the straight sinus, which as the name implies is very straight, the cavernous sinus, internal petrosal sinus, occipital sinus, all coming together in the confluence of the sinus. So here you have this big, large area here, and that is the superior sagittal sinus. Here you can see the sinus. We have this large area going up, and notice how close it is in proximity of itself to the skull. This is the superior sagittal sinus running up at the top portion of the head. Then we have anterior sagittal sinus, internal cerebral vein, the straight sinus coming down, and then coming down here will be the superior sagittal sinus, all coming together here, which is the confluence of the sinuses. This area here will be the confluence of the sinuses, and you have the straight sinus feeding into it here. But additionally, you have the calcified choroid plexus, calcified pineal gland. This is probably going to be the fourth ventricle, falx cerebri. Looking at the occipital horns of the lateral ventricle. This is something that you will see several times on CT, which kind of confuses a lot of people, because when they see this, they think that this patient has a bleed and I've just injected contrast, and what am I going to do? But actually, this is quite normal. This is pretty much the transverse sinus, which is getting ready to come into the confluence of sinuses. Okay, so superficial, cortical, and deep veins. The superficial cortical veins are located along the surface of each cerebral hemisphere and are responsible for draining the cerebral cortex and portions of the white matter. Veins drain into the dural sinuses with numerous anastomoses between the superficial and deep veins. The deep veins of the cerebrum drain the white matter and include the thalamomoral striate, the septal, internal, cerebral, basal, and great cerebral vein. So once again, we're looking at the sinuses. We have the anterior cerebral artery here with all of its branches, but then we also have venous return very quickly. We have the straight sinus, the confluence of sinuses. We have the superior sagittal sinus. Let me rephrase this. This is the superior internal cerebral vein. This is the superior sagittal sinus, and you can see it kind of running here. The reason we say this is because we have these spots where we can see separation from the skull. And it's coming down. We even meet it here. Also, we have the sphenoid sinus, frontal, fourth ventricle, cerebellum. And that's pretty much all we can distinguish here. So that brings us to one of our final topics, which are the cranial nerves. There are 12 cranial nerves numbered from anterior to posterior according to their attachment to the brain. Basically, all I want you to know is what each nerve actually does. Cranial nerve number 1 is called the olfactory nerve, which is the nerve of smell. Pretty self-explanatory. Cranial nerve number 2 is the optic nerve, which is, the name implies, is the nerve of sight. Cranial nerve 3 excuse me, is the oculomotor nerve, which moves the eye by supplying fibers to all extraocular muscles of the eye except the superior oblique and lateral rectus muscles. The trochlear nerve is cranial nerve 4 and innervates only the superior oblique muscle of the eye. Cranial nerve 5 is the trigeminal nerve, which is the major sensory nerve of the face. You've probably heard of trigeminal neuralgia, and that is where this stems from cranial nerve number 5. Cranial nerve 6 is the abducens nerve, which supplies motor impulses to the lateral rectus muscle. Cranial nerve 7 is the facial nerve, which innervates the facial muscles, lacrimal gland, and sublingual and submandibular glands. Cranial nerve 8 is the vestibulocochlear nerve, which is dealing with hearing and equilibrium. Cranial nerve 9 is the glossopharyngeal nerve, which is posterior, which controls the posterior third of the tongue and monitors blood pressure and pharynx. Cranial nerve 10 is the vagus nerve, which controls the pharynx, larynx, thoracic, and abdominal viscera. Cranial nerve 11 is an accessory nerve, which innervates the pharynx, palate, and larynx. Cranial nerve 12 is the hypoglossal, which is controlling the tongue muscle.